Okay, so for activity 3, gross anatomy of the kidney, I'm just going to go through all the highlighted terms on your learn list. So the renal capsule would be on the outside. I showed you the clear renal capsule on the torso model. Then we have the cortex is all of the outer region here. Medulla is going to be all of the inner region here that's made up of these renal or medullary pyramids. Okay. You can see from the renal pyramids that the urine flows from a minor calyx, here's minor calyx, to a major calyx here, which would eventually lead to the renal pelvis. So again, all of these right off the renal pyramids are all minor calyces. The larger regions that those drain into would be a major calyx. Here's a major calyx here. And then all of them are going to lead into here, number 4, which is the renal pelvis, and then eventually to the ureters out here. It does make a little note about kidney stones and passing a stone. So they can form blockages here in the minor calyces or major calyces, or they can get stuck here in the pelvis, but they can also get stuck as they're going down along the urinary tract, along the ureters, and they would be scraping the urinary tract mucosa on the way down, which could cause blood in the urine. And then identify the renal artery and vein. Here's the renal artery supplying blood to the kidney, renal vein for blood coming out of the kidney. And don't forget that the urinary system receives 25% of cardiac output at rest. And then the renal corpuscle. So know that this whole entire structure here is the renal corpuscle. And the renal corpuscle is going to include the glomerulus, which is this ball of capillaries here that has fenestrated capillaries, as well as podocytes on top. So normally the entire structure would be covered with podocytes, but this is just to show you with the podocytes on top and the fenestrated capillaries underneath. So this whole ball of capillaries here is the renal corpuscle. The outside capsule here is called the glomerular capsule, also sometimes known as the Bowman's capsule. So those two things together, this whole structure here with the capsule and the glomerulus, that is the renal corpuscle. And then we have the nephron. So the nephron is going to include the glomerulus and the renal corpuscle here. So the nephron is the renal corpuscle plus the proximal convoluted tubule. Then we have the descending limb of the nephron loop, the actual nephron loop, ascending limb of the nephron loop, and then the distal convoluted tubule. All of that is considered a nephron. So from the renal corpuscle to the distal convoluted tubule, that is all considered a nephron. And your kidneys have about 1 million nephrons per kidney. And then all these nephrons are going to attach to a collecting duct, but know that the collecting duct is not part of the nephron, it's separate. It would be the step after the nephron. And that's all for this first part of activity 3. And then again, it says to make sure to note that the collecting duct is running through the renal pyramid and will eventually become a minor calyx. You can see that here as well. Here's a collecting duct running all the way through the renal pyramid and finally emptying into a minor calyx. Once it's in the minor calyx, we are no longer making modifications to that fluid, and so then it becomes urine. So it'd be urine in a minor calyx, but in the collecting duct where we're still making adjustments and still removing water, sodium, things like that, it would still be considered filtrate. But once we get into the minor calyx, then it's urine. I went through all those structures: capsule, cortex, medulla. We went over the renal corpuscle. Now flow. Okay. So I do have this in another video when we talked about GFR and all of that, but I'll just go ahead and name the structures. So this is going to be the afferent arteriole coming in. How you know it's the afferent arteriole is because these cells here, those are granular cells, and you're only going to find granular cells on the afferent side. So afferent arteriole with the granular cells enters the glomerulus. Efferent arteriole on the other side is blood exiting the glomerulus. I think that is, well, from the efferent arteriole, then that blood would eventually go through and into the peritubular capillaries or the vasorecta. So peritubular capillaries is associated with the cortical nephrons, while the vasorecta is associated with the juxtamedullary nephrons. And I show the difference between those and show the peritubular capillaries versus the vasorecta in the nephron video. You can kind of see this here. These would be peritubular capillaries, but this doesn't really show them around the nephrons. It kind of shows them separately. This would be the vasorecta, but you can't really see that on this model. It's much better on the nephron model. And in that other video, we do talk about the whole filtration process. Once we filter out blood, it gets captured by the capsule here, and it goes through the proximal convoluted tubule, down the descending limb of the nephron loop, to the nephron loop, to the ascending limb of the nephron loop, and then to the distal convoluted tubule, before then going through the collecting duct, minor calyx, major calyx, renal pelvis, ureter, urinary bladder, urethra, and then out the external urethral orifice. And then I think that's it, because I do go through all that filtrate, trace a drop of filtrate in the other video. I think that might be it. I think I went through everything. So there we go. There's activity number 3. One small thing I'll add is here in this section here is where we'll find the juxtaglomerular complex. You're going to have these granular cells here that will act as mechanoreceptors that are going to detect stretch here. And so if blood pressure is too high and blood is flowing too fast, these granular cells are going to constrict the afferent arteriole, so less blood is allowed to come in, and it kind of slows down flow if it's too high from hypertension. Or vice versa, if you have hypotension and blood pressure is just much too low to make enough filtrate to get this flow moving fast enough, then these vessels, the granular cells, will detect that, dilate the vessels so that more blood rushes into this glomerulus, so you can speed up the flow and make more filtrate. Macula densa cells, which in the textbook show on the outside of this part of the tubule here, so they might be over here, but just know that they're associated with the tubule. You have macula densa cells here that are going to act as chemoreceptors, detecting the level of detecting the level of sodium in the filtrate, which will actually give us information about how much is in the blood. So if there's too much sodium in the filtrate, that means there's not enough in the blood. If there's too little sodium in the filtrate, that means there's too much in the blood. And your afferent arteriole will adjust to adapt to that. And now I think that's it.